Good evening, everyone. I'm Dr. Manohar, working as consultant physician in SSM Hospital, Kerpuram, Hassan. So I take this opportunity to speak a few words about hepatitis. So July 28th is considered as World Hepatitis Awareness Day. So in order to bring awareness regarding the disease among the public, we have come out with this initiative. So the theme for this year's Hepatitis Day is It's Time for Action. So basically, this hepatitis is caused by viruses. So hepatitis A to E, A, B, C, D, E, and C, M, V, E, B, V. These are few viruses which can cause hepatitis. Basically, hepatitis is inflammation of the liver. So any inflammation caused due to this viral infection leads to a condition called as hepatitis. So the symptoms of this disease is fever, chills, pain abdomen, loose stools. A patient might have jaundice and also flu-like symptoms. So basically this is spread through two mechanisms. One is fecal-oral route and other is sexual mechanism or the parental exposure. So A and E are among the two diseases which was spread through fecal-oral route. That is unsafe hygiene, eating outside foods, roadside food habits, drinking polluted water. All these things will cause hepatitis A and E, which is spread through fecal-oral route. Symptoms will be mainly loose stools, fever, and pain abdomen, also including jaundice. So other things like B, C, D are caused by parental infection or sexual transmission. So these are I'm here to talk about few do's and don'ts regarding that disease. So once the patient is diagnosed as hepatitis, so patient needs to rest properly and take sufficient well-balanced diet and drink lots of water. Around 1 to 2 liters of day water needs to be drunk every day, and patient needs to quit alcohol, tobacco, or any drugs which he is consuming. Okay. And once the patient is having this A and D, patient needs to have proper sanitation and hygiene should be maintained. And every time the patient goes to bathroom, patient needs to use soap and disinfectants. So once the patient is diagnosed as BCD, he needs to take care of himself, get his spouse or any other people who come to exposure vaccinated, and wounds and sores should be taken care of using proper medical channel. So now one needs to avoid accidental exposure to prevent the spread of the disease to the kids or spouses. So also one more initiative taken by the government is to get all pregnant women vaccinated in order to prevent parental transmission of the disease during pregnancy. And also safe and healthy sexual practices needs to be maintained to avoid the spread of disease. Now coming to don'ts, patient needs to use all personalized items. That is, once the patient is infected, he needs to have his own personalized infection. Sharing of the things like razors, toothbrushes, syringes, needles should be avoided. And patients once diagnosed as a hepatitis patient, he needs to avoid donating blood or breastfeeding if the baby if you are infected. Also, you need to quit alcohol and tobacco. And patient who are traveling to other diseases needs to be vaccinated properly, and try to avoid traveling to the countries which are endemic to the disease, or with patient where the countries have poor sanitation. Also, over-the-counter drugs needs to be avoided. So don't go to the pharmacist taking the drugs. You need to consult a doctor once you are having hepatitis, and treatment schedules should be followed. Also, do not drink contaminated water or avoid exposure to the infected patients. Thank you.